12. Now, with chapter 12, because of the time, I'm actually going to take this a little light, okay, and I'm just going to go over certain slides. So I'll tell you which slides we're going to focus on, and then we're going to omit pretty much the bulk of that goes over into a whole bunch of micro. And then we're going to just go back into the clinical stuff with it, okay? So, with HIV and AIDS, we all know what happens with this particular disease process. As you know, HIV definitely attacks the T cells. Now, one thing that you should know is that when it attacks the T cells, also known as our T helper cells actually have two different functions. T helper cells, and this just goes with basic anatomy and physiology, if you remember, T helper cells actually attack, or I should say they help make B cells, and they also help with the attacking of different viruses and also any type of cancer-infected cells or any kind of harmful microorganisms that come into the area. So the problem here with this, as you know, T cells actually, when we have this type of virus that attacks the T cells, it's attacking the T cell that's supposed to attack the virus, okay? So this is a major, major issue with this particular virus, as you know. And it causes these individuals to be immunocompromised, and the fact that they don't have the T cells to pretty much pretty much take care of their infections. No, I'm sorry, Dr. Lerner. I'm trying to know what's going on. So, in any event, you know what happens with that. Now, just to let you know, and I think you guys know this information a little bit already from micro. You want to come in? Come on in.
How you
It's
do.
okay.
We're
recording, by the way.
Exactly.
Come into the
Exactly.
Oh gosh. You need the browser here?
Yeah, that's
Oh, it's in the back.
See, it's always in the back.
It's in the back.
Sign in first.
Now you get to see who didn't sign in.
Right, exactly. I'm not that I'm going to take it, I'm just going to look.
And it's
Classes get- No, they were all here. It's just
I believe it's fine.
they were all
We were
here.
carried away with our Patho case studies.
so much.
Okay, so going back to this particular disease, keep in mind that as you remember, I'm sure you went over this in micro, that there are two different types, type 1 and type 2. Now, keep in mind that, as you know, this is the most, well, I shouldn't say the most common, but it is a common pandemic disease that, you know, that goes across the board all over, pretty much not just the U.S. and other countries, okay? And they have there all the deaths in pretty much different regions. Now, HIV-1, just to let you know, has at least 10 different subtypes. Now, I remember reading something a couple of years ago that they were trying to come up with a vaccine, okay, for HIV. And it's definitely going to be quite hard to come up with a vaccine, and I know they're trying to do this because of the fact that it has 10 different subtypes, okay? And as you know, with viruses, they do tend to have different types of it. Now, HIV-1, just to let you know, this is definitely prevalent in Central Africa, U.S., Europe, and Australia, whereas type 2, or HIV-2, is actually just more common in West Africa, okay? Now, 3 types of transmission, as you know, and now just to make it simple, let's just say oral, anal, and vaginal sex. Just to make it simple, okay, so they have here vaginal secretions, different sexualities, intercourse, whatever, but basically it's just those 3 routes. Keep in mind also peritoneal transmission through blood contaminating needles, and then peritoneal obviously through utero delivery, and also through breast milk, okay, can also be a mode of transmission. These are areas that are not known to be modes of transmission, okay, so to speak, and they do have here common modes of transmission. They do say IV drug users, people that have unprotected sex with sex partners. Most of this stuff you guys know already. Recipient of HIV contaminated blood. I believe that, what was it? I think it was before the 80s or somewhere around 78 or before the 80s. They were not testing the blood that people would give in blood banks for HIV. Okay, so any individuals that did receive blood prior to that year, okay, have to be continuously tested for that. So that's that. And then unanticipated needle or scalpel injury. I will go over with you what may happen, or what you guys should do as far as a protocol if for some reason, if you are working in an environment that you do get stuck, unfortunately, with a needle from a patient that may be HIV-infected blood, okay? So we will go over that. And believe it or not, this is where I would say your technique comes in also when you're doing blood draws and any type of things like that you're going to be working with patients. Believe it or not, I've seen this done, but I've seen people do blood draws without gloves on, okay? And I know it sounds crazy, but I've seen it. People do get lazy in the field and they just do whatever. So this actually just comes from sticking to your procedures and protocols that you're supposed to do. Okay, and I'm sure you guys will go over all that information in nursing. Okay, so all this talks about is sex, so we know. Okay, so sex, whatever kind of sex you're having. Now, again, blood bank, we already talked about that. Okay, so with the blood bank, keep in mind, again, these individuals did not that had this blood transfusion, or that we had blood bank from blood that came from a blood bank before the 80s, definitely have to get tested for that. Healthcare workers that are exposed have to be careful, definitely, if they get any type of puncture or injury from a needle stick or scalpel or anything like that. Okay. So mother to baby, okay, we all know that this can happen, and they say intrapartum, which is the period at delivery, is actually the most common. Okay, because there is obviously more blood, okay, during delivery. Okay, so greatest risk in the U.S., what they do say is individuals that with sex, and see they have here, I'm just going to say all types of sex. Okay, we'll just leave it at that. Saying the same thing over here. And then when we go to different regions, they do say that it's also sex, contaminated blood, and perinatal transmission. Okay. And they say in the third world countries, it's more of an issue with prostitution and different sexual partners and things of that nature. Now, so for prevention, we all know what to do as far as abstinence, condoms, okay? Now with the drug users, they do try to at least educate them on using clean needles, okay? So in that type of education format, you have to do that. Now, if for some reason you guys are working with a patient, okay, that is HIV infected and you get poked with the needle, okay, that is infected with that particular HIV infected blood. The protocol, from my understanding and just reading this, and I believe this is a protocol for hospitals, and I think they have another type of protocol that they use. But basically, you're supposed to have an administer of 2 reverse transcriptase inhibitor, right? And this has to be given within 72 hours, okay, of the needle stick. And if it gets more advanced, then there's another inhibitor that has to be given. Now, I don't know exactly how they monitor this, so in 4 weeks, I guess they monitor and see, okay, and then just continue testing and so forth from that. But there is something that can be done within 72 hours. Okay. Now, going into the etiology, we all know that HIV is an RNA retrovirus, and then we all know that it converts to the DNA and then back to the RNA so we can spread and make copies, okay? So we already know that. Now, I'm going to omit, let me just tell you right now. And I'm sorry because I'm rushing because we're running out of time. I am going to omit all of those slides that go over all this micro. Did you guys go over this in micro?
Yes.
Okay, so we're going to omit all of that micro, and we're going to pick back up at slide 54.
So etiology a lot. No. Wait, where did we stop?
Where did you stop? You stopped at
That RNA retrovirus, is that what you
right
wanted?
before that. So yes, that's where I stopped. So I stopped at 16. I stopped at 16 and then we're gonna pick back up at 54. Okay. So I don't want you to think you're missing anything. That information, so I don't want you to feel cheated, okay? That information is what you guys went over in micro, okay? We're not gonna repeat micro, you went over all of that. No, I'm not testing you on that, I'm not testing you on micro. Patho, we just wanna stick to how it acts in the body clinically. Okay, so we're not gonna go into all the different genes and what happens. Okay, now let me show you this video. And I like this video because it really goes through all the different stages of HIV and it shows you what happens with the CD4 counts and the different types of conditions and diseases that do happen at those levels, okay? And which is, I think, will be good. And then we're going to go over that with, on the PowerPoint as well.
HIV is a tiny virus carried in the blood, in male and female sex fluid, and the breast milk of an HIV-infected person. HIV-infected fluids can enter a person's body through breaks in the skin and enter the blood.
It's a cute little animation. It's still fun.
Tiny police cells are present in the blood to protect a person from germs that cause infections such as TB and the flu. These police cells are called CD4 cells. HIV harms the body by attacking the CD4 cells and making the body more prone to other illness-causing germs. The good news is that a person with HIV who lives a healthy lifestyle, gets regular medical care and takes medication can live for 25 years or more after infection. However, the individual who fails to take these steps will experience a series of infections, lose weight, and usually die within 10 to 12 years. A person who has HIV but does not get treatment by a doctor or nurse will go through the following stages. Acute HIV infection. At some time during the first month or so after HIV enters the body, a person may have a flu-like illness. Symptoms may include fever, fatigue, rash, headache, swollen lymph nodes, and sore throat. Some people have no symptoms at all. The viral levels at this time are very high because at first the body is unable to fight the virus. During this time, the HIV antibody test is negative. This is called the window period. Within about 1 to 2 months, the body begins to produce antibodies to fight the virus, and viral levels drop. The rapid HIV antibody test detects these antibodies, not the virus. A blood test can be done in the hospital or clinic to measure how many CD4 cells a person has. This test is called the CD4 count. During this time of acute HIV infection, the CD4 count goes from a normal level of 1,200 down to about 900. The viral levels at this time are very high because at first the body is unable to fight the virus. Within about 1 to 2 months, the body begins to produce antibodies to fight the virus, and viral levels drop. After the initial infection, the body can effectively fight the HIV for about 5 years. This period is called stage 1. During this time, the CD4 police cell levels drop from about 900 to 500. At the same time, the HIV levels in the blood slowly rise. Although generally symptom-free, a person in this stage can still pass the virus on to others. From about 6 to 9 years after infection, a person is in stage 2 of HIV infection. During this phase, the CD4 count may go down from about 500 to 350. At the same time, the HIV levels in the blood slowly rise. Swollen glands appear in the neck, armpits, or in the groin. A person may feel weak and tired and experience fevers and weight loss. The number of CD4 cells is now so low that other germs that cause infections find it easier to invade the body. This makes it so flus, coughs and colds, skin rashes, shingles, fungal nail infections, and mouth sores become more common in this stage. After about 9 to 11 years of HIV infection, the CD4 count drops below 350 and the person enters stage 3. HIV viral levels continue to increase. In addition to all earlier symptoms listed, a person may have abdominal pain, ongoing diarrhea, cough, and headaches. Additionally, painful blisters of the mouth or genitals may happen again and again. Within about 11 or 12 years of HIV infection without medical treatment, a person enters stage 4. Another name for stage 4 is AIDS. The CD4 count drops below 200 and the body begins to lose its long battle against HIV. Viral levels are high in the blood. Severe life-threatening infections occur in this stage. ARVs work better if started before the later stages of HIV. The decision of when to start ARVs is made by your healthcare provider. ARVs can dramatically reduce the HIV in the blood. Other medicines may be prescribed to prevent and treat other infections such as TB. It is very important that once ARVs are started, that they are taken as directed. If doses are missed or the ARV stopped entirely, the ARVs may stop working against the HIV in the future. The good news is that ARVs can give a person.
So we saw the whole. Okay. Now the reason why I like that video there is because it really breaks down the different categories for us. So please make sure you know the 3 different categories that are listed here. So when a person's in category 1, the CD4 cell count is going to be above 500. This is slide 54. Slide 54. You got it? Okay. So slide 54, category 2 is going to be somewhere between 200 to 499. And then when we talk about a category 3, this is CD4 count of less than 200. Please understand, and I'm quite sure you know this already, when the CD4 count drops below 200, this person is said to have full-blown AIDS. Now, what can happen is, please understand that if a person has full-blown AIDS, that they cannot go back to being in an HIV stage. But when people are in an HIV stage and taking medications, can the CD4 cell counts go back up a little bit? Yes, they possibly can. But once they get to pass or less than 200, that's it. They can't go back up at that point. Now, the other things here that they also showed you in the video, please make sure you know the different conditions that fall under those categories, okay? And I will test you on this next week. So make sure you know that category 1 or A, the first category, these individuals are considered to be asymptomatic in the beginning, as we know, with an acute HIV infection and all the way to several weeks, okay, to months. Then they can have a little bit of the lymphadenopathy, okay? Now, when they get to the second category or the second stage here, what happens is that they will start to have some different or more types of I would say infections like fungal infections, fever, they'll get shingles, pelvic inflammatory disease. So they're going to get more sort of bacterial and fungal type of infections at that stage. Then when we get down to category C, which is now marked as AIDS, or the last stage, these individuals will pretty much get, I don't want to say everything, but any kind of opportunistic disease that can go along with this. Okay, so not to just pinpoint what diseases, but they can pretty much get anything. Now, this chart you don't have to worry about. To me, it's a little confusing. You don't have to worry about that chart. Now, the next couple of slides, I'm just going to highlight, and I want you to read through this information. Some of this will definitely sound familiar from you from micro, but I just want to highlight the most common conditions, or the ones that I'm just going to focus on, that are indicative in people that do have HIV or AIDS. Okay, people that do have AIDS. So candidiasis, okay, as you know, candidiasis can definitely be found in these individuals, so please highlight that. I will also highlight encephalopathy. I will also invite herpes simplex. I will also highlight Kaposi sarcoma. Kaposi sarcoma is a cancer that is just related to people that have AIDS. Please make sure you understand that it is a type of skin cancer, well, I'm going to say skin cancer, but more of a type of epithelial origin cancer that is only in these individuals. Please also highlight lymphomas, okay, which we just went over, and we know that non-Hodgkin's lymphoma is definitely one of those, okay, that fall into that category. The other thing here, going to the next slide, please make sure that you highlight Mycobacterium tuberculosis, which I'm sure you guys went over that, possibly a micro, and pneumocystic gyrovecii pneumonia, okay, which is one of the most common conditions that do come out of AIDS patients. And when AIDS first came out or was first discovered, this is what most of the individuals were dying from anyway, the pneumonia, okay. And then wasting syndrome, which we know kind of goes along with that. Okay, and that's that. Okay, now I'm not going to go over HIV classification in children, so we can cross that out. And I'm sorry, I'm just breezing through this because we only have a little bit of time and I have to review. Diagnostic testing. So I'm going to go through the 3 diagnostic tests and then we're going to stop there, okay? So the ELISA test, I'm sure you guys went over that and understand what it is. Please keep in mind that this test is highly sensitive, specific, and it can be performed for both HIV-1 and HIV-2. Okay. Keep in mind with all the tests, and I'm sure you guys know this by now, is that the test actually tests for the antibodies and not the virus itself, okay? So hence the reason why, and please understand this too for education purposes when you're educating your patients in the future, that if they do feel that they may be, put themselves at risk or may be at possible risk for the virus, and they just had exposure to it, you have to educate them that, okay, even if they're testing now, they have to test again within the next 3 months, okay? So that's important to know because that way, by that time, the body has now, if that person is infected, has now started to produce antibodies that will be present, okay? Western blot, as you know, is, this one uses the electrophoresis. Okay, very expensive. And they use this pretty much as a follow-up. It's not the initial test, okay, that's done, but they do use this as a follow-up to a positive test, okay, and a positive ELISA. And that's that. It's very specific. You have to wait 1 to 2 weeks for the confirmation. And then the last one here is the Oral Quick Rapid, which they are now selling over the counter, okay, which I think is a good idea. But the only issue here with the Oral Quick Rapid is that patients sometimes can get false negatives just because of technique. Okay, so just keep that in mind. You get the results in 20 minutes, and that's cool. But it should always be followed up, you know, with a blood test. Okay, with the ELISA. Okay. All right, and I'm stopping here. Okay, I know it's like cut out like all of 12, but I have to stop there for the sake of time because I only have a little bit of time left and I have to review. So you're stopping. Let me tell you exactly what it is. Okay, so you are responsible for chapter 12. Let me tell you what you're responsible for. You're responsible for slides 1 through 16. And then you're also responsible for slides 54 through 65. So it's not much information.
Chapter 12.
Yes.
But that chapter 12. And again, with HIV and AIDS, it's not that, okay, we're cutting out a whole bunch of stuff. A lot of that stuff you guys know already. Okay, so it's not anything that's not new to you. No, because that way I would have to go over each and every opportunistic disease, and I'm not going to. Okay. Now, please understand, just to kind of start this review for next week, let me just give you some highlights, okay, some key points here. Obviously, please look at the pictures, okay, of all the different leukemias and lymphomas, and we did that today with our in-class assignment, which you guys enjoyed, okay. Just how you wrote those case studies for the in-class assignment, I will tell you too, when you're practicing at home, okay, or studying, to try to practice writing case studies for each one. Next week's test, you will have a bunch of case scenarios, okay, so that was the purpose of, you know, having you do that assignment today. So I will have maybe a picture, but then I may have a question about, okay, well, what type of treatment would this person get, or what type of sign and symptom that may be associated with this treatment. So the questions are not going to be straightforward. I will also have questions that are going to be NCLEX style. So the question types are going to be a little more difficult than this week. This week was easy street, okay? The other thing, please make sure when you go through the different leukemias and lymphomas to definitely put them in categories as to the common signs and symptoms. So however you want to categorize, just try to categorize it somehow, okay? What else? I feel that the leukemias and lymphomas are straightforward, although last term students said they had a hard time with that test. I don't know. But I think it's straightforward, but we'll see what happens. If you have any questions with it while you're studying, just please let me know. I do have practice case studies that I do give out during, what is it? Tutoring, thank you. During tutoring, I'm sorry, I'm tired, I've been here since 6 this morning. During tutoring, so just make sure that if you do come for tutoring, or even if you don't get a chance to come to tutoring, just kind of come by and see me, and I'll give you the practice case studies and the practice quizzes, okay? So that way you can, you know, try to get practice with some of the information. Now, with 12, even though that we didn't go over a lot of information with 12, please keep in mind that with chapter 12, I'm still going to ask clinical type questions, okay? So try to formulate that information somehow. So say for example, like I told you, if you have a patient that feels that they have exposure to the virus, there's going to be a question, okay, how would you educate this patient on testing? How would you educate this patient on explaining to them what types of signs and symptoms that they may have if they're maybe at a category 3, okay, or a stage, I'm sorry, stage 3, okay? So just try to, the information's easy, but it's just the way to word it, okay? So just understand that it's going to be in a patient sort of format. So if you have to explain to a patient, okay, well, now you're in a stage of going into full-blown AIDS, so now you're going to have these types of conditions. You may start to see a Kaposi sarcoma that may come up, or whatever, okay, that goes along with it. So the questions will be sort of geared towards that. I think you guys will be fine. Any particular questions about the leukemias, lymphomas? Was everyone okay? Anything confusing? Okay. All right, I think we got it down, and I think the class assignment kind of helped out. All right, I'm done. I'm kind of tapped out for
the
today.
practice test on e-college?
Come to my, I have to see, the problem is I have tons of paperwork like this, so I just need time to upload them all. When would I have that time? I don't know. I'm sorry, can you shut that camera off? When would I have that time? I don't know, but I do have the